we hear these two terms, and you hear them all the time. They're in popular magazines. They're also in the medical literature. There's bone density, low bone density, and then there's osteoporosis. What is the difference between low bone density and osteoporosis?
It's a good question. So low bone density means bone density that is below the T-score fracture, WHO fracture risk minus 2.5 definition. It's important to realize that patients with low bone density fracture, particularly patients on steroids, and low bone density and other risk factors increase one's risk of developing the clinical syndrome of osteoporosis. So osteoporosis, as you'll hear this evening, is many things, and it's a continuum. It could be a T-score. It could be somebody who's had a hip fracture. It could be somebody with low bone density and other risks who's at risk for fracture, where we want to intervene before something happens.
Let me take a swipe at this. Low bone density is a number that you measure. It's a lab result. Osteoporosis is a clinical syndrome. Is that fair?
Absolutely. And I wanted to emphasize or re-emphasize something that Tom said. It really is a continuum of disease. We get hooked on numbers sometimes. So the World Health Organization has helped in terms of that definition, which is a bone density definition. But when we look at and treat patients in the real world setting, we're taking into account a number of factors, right? Bone density is part of it. The lower the bone density, the greater the risk for fracture. But we need to look at clinical risk factors and all kinds of other scenarios.
So it would be fair to say to a patient, look, I measured your bone density, it's really low, you're at risk for osteoporosis, as opposed to saying your bone density is low, therefore you've got it.
Well, you can define osteoporosis by the T-score alone, but we shouldn't stop there. So there are other people for whom their bone density may not meet criteria for osteoporosis, but they may have what we call a clinical diagnosis of osteoporosis because we take into account the bone density number and then the rest of their individual picture.
Okay, if it is a clinical syndrome, then there are symptoms associated with it. What are the symptoms of osteoporosis?
Well, there's a lot of different symptoms with osteoporosis. Sometimes, though, it can be asymptomatic. So oftentimes, patients don't realize they have osteoporosis until they actually fracture. And that's what makes it confusing by patients, I think. They feel fine. They think, I'm doing my normal activities, I'm okay. And then they go to their doctor and they get a T-score that shows them that they're actually at very high risk of fracture, and it becomes confusing.
What about the comorbidities? What goes along with osteoporosis?
Yeah, just about everything, or maybe nothing.
Oh, that's really helpful.
So thank you. It is the silent thief. So the comorbidities that I'm concerned about today, type 2 diabetes, which has a lot of risk, rheumatoid arthritis, which independently increases the risk of osteoporosis, COPD, patients with COPD who smoke or don't smoke are at risk, chronic kidney disease, any type of inflammatory disease, or any other illness that weakens a patient, maybe makes them less active. But essentially, we see many patients with either low bone density and other risk factors who have the clinical syndrome, who've had a fracture, or patients with a T-score who have high blood pressure, high cholesterol, and it's really the gamut. There's no question that the comorbidities make maybe the treatment decisions and the discussions with the patient a little more difficult.
I would also add, I think there's one thing that often confuses patients too, is height loss. So that's one of the symptoms of osteoporosis. And if you've lost more than an inch of height within a year, that's a potential symptom, and it's something should be addressed. Many people think as we grow older, we get shorter, it's a normal part of aging, and there is some height loss that comes with aging, but significant height loss, like over an inch in that amount of time, is a symptom of osteoporosis.
It's funny you mention that, because when I take histories from patients, I usually take their height.
Right.
And they always say, well, you know, I'm shrinking.
Right.
And these are usually people over 65, 70 years old.
That's right.
So you're telling me that some of those people should be worked up for osteoporosis?
Absolutely.
The reason that's so important is that height loss may be an indication of a spine or vertebral fracture that has gone unnoticed.
Got it.
Okay, about 2/3 of vertebral fractures don't initially present with symptoms, or they may present with symptoms, but back pain is common. Right? So people think, I had a little back pain, it's probably muscular, and they don't think much about it.
And it was a fracture all along.
But it was
and
a
now they're an
fracture
inch
all
shorter.
along. Exactly.
You know, the other thing you mentioned is a number of these immunologic diseases that are often treated with steroids. And the first thing that crossed my mind was, where's the confluence here? sometimes it's the disease, but I'm thinking sometimes it's the therapy.
Yeah, it's the therapy a lot of times, but it's also the inflammatory mediators that have effects on bone and effects on muscle and effects on wellness and activity. And there's still a lot of things we don't know about the illnesses. So again, patients with lupus is not necessarily an independent risk factor, but clearly patients with lupus, bad lupus, need patients who need more glucocorticoids and other immunomodulatory therapies clearly break bones. Same thing with patients who have inflammatory bowel disease.
Yeah, I was going to say, you put them on prednisone, the ball game is a different ball game.